A mastopexy is our name for breast lift. A mastopexy augmentation, which is on a separate video, is for a breast lift with an implant. This video is just on the breast lift. So let's say you like your breast size. Then maybe a breast lift alone is the right choice for you. On the other hand, if you really like a nice round upper pull, as we call it, to your breast, and you've got a bit of a ski jump now, we're not going to be able to give you what you want without an implant. So for those patients, again, you like your breast size, but you want more fullness in the upper half of the breast, then maybe a mastopexy with or breast lift with an implant is a better choice. So a mastopexy or breast lift alone, we're rearranging your breast tissue. We're taking the sagging bottom part and moving it up to the center part of the breast. Now you might ask, why can't we move it to the top part of the breast? And we kind of ask the same questions because we haven't figured out how to do that. So we can take what's sagging, move it to the center, give you a better breast shape, but we cannot fill the upper pole of the breast, and we cannot move the breast footprint higher up on the chest wall. So what does a mastopexy or breast lift involve? Well, it involves moving, as I said, that sagging breast tissue, moving it up. You get a scar around the areola and down, and you get a nicer shape. But if you, as I said, if you want the fullness, you'll need an implant. Mastopexy surgery takes about 2 hours. The breast lift surgery is about 2 hours. You're under general anesthetic. There's actually not a lot of discomfort afterwards. You can go back to doing normal everyday things actually in a few days. Exercise, more physical activities, it may be a week to 2 weeks. So for example, returning to work will depend on the kind of work you do. If you're doing desk work, a lot of patients will go back to work in a few days. If you're in construction, it might take a couple of weeks before you're back at work. The problems with breast lift surgery, the expected problems, are scarring, perhaps losing sensation, and maybe not being totally happy with the breast shape. Unexpected complications that may happen are things like infection, which is usually easily treated with antibiotics. Losing circulation to the nipples. Now that's an important one, pretty rare, but if you're in that person, then it's very important. What happens is we're not removing the nipple. Think of a button on a coat and you've moved it up to the wrong buttonhole. That's kind of what we're doing with a lift, breast lift type of surgery. I'm not removing the nipple, I'm moving it. In the process of moving it, I'm taking it away from some of its normal blood supply, some of its normal nerves, and some of the normal breast ducts. Well, the nerves and the ducts can take time to recover and hook up again. And that's why we say breastfeeding is possible. It might be 50-50 for patients. Sensation will recover. About 85% of patients will recover normal to near normal sensation, but I need that blood supply right away. So I will talk to you about your particular risk, and it really comes down to how far I have to move the nipple. If I have to move it a long distance, then the risk is a bit higher. But so for most mastopexy breast lift patients, it's a complication, potential complication that is extremely rare. So basically breast lift surgery is pretty straightforward, general anesthetic with a fairly easy recovery compared to a tummy tuck surgery. For example, when I'm doing both at the same time, patients don't even notice the breast, it's the tummy that's uncomfortable. So if a patient just likes their breast size, wants a lift, a mastopexy or breast lift is a one-time procedure. It should last a lifetime. Unless you did things like pregnancy or massive weight loss and weight gain, a mastopexy breast lift is a one-time operation. On the other hand, if you want more fullness or an increased size, then you have to add an implant. And then that is not a one-time operation because the implants do not last a lifetime, and we think maybe about 15-20 years. So you need to watch the mastopexy augmentation or breast lift with an implant video, as well as this one on just the breast lift. So if you're considering breast lift surgery with or without an implant, check out the website for different patient examples. And if you need to, call the office and they can actually send you a copy of our handouts.